Hi everyone, my name is Michelle Andrews. I know you're familiar with me from the class postings, but I still wanted to formally introduce myself. So hi, I'm currently working as a certified emergency registered nurse in Dartmouth, Nova Scotia. I am from the East Coast, originally from Cape Breton, so I hope you can bear with my Cape Breton accent. Also, thank you for watching my presentation. So as you can see, I'm going to talk about nurse burnout and the effects of coping and stress management. So I've created this PowerPoint using a breakdown of 3 categories, which roughly coincide with our assignments. A quick overview of what I plan to talk about. I'll start by describing the background of burnout and its relevance to the nursing profession, consequences and outcomes that result from increased burnout. I'll also talk about my objective research question, which followed the population intervention comparison outcome format. I will discuss some reasons for why I chose my particular question. Moving down to the research findings portion, I'm going to talk about some work-related and demographic factors that contribute to burnout. I'll discuss some effects of stress management and coping strategies on nurse burnout. Several studies have shown mindfulness-based practices as superior coping strategies, and I plan to talk about those. I will touch on how yoga can play a role in reducing stress, subsequently reducing burnout. And finally, I will talk about the intervention I created in an effort to reduce nurse burnout. It consists of a 2-part solution that begins with educational sessions for nurses, incorporating mindfulness-based techniques, followed by implementation of learned techniques into the busy clinical setting. Interest for my PICO question stems from personal feelings of emotional exhaustion and decreased satisfaction with previously satisfying tasks. I wanted to explore the literature available on burnout related to nursing to see if there were any stress management or coping strategies that helped decrease burnout. I found that among all healthcare professionals, nurses are at increased risk of developing burnout as they consistently experience overwhelming tasks, high demands, and stressful situations. As a result, nurses have increased sick leave, absenteeism, and staff turnover ratios, which often leads to greater workload for the remaining nurses and decreased quality of overall patient care. Burnout also has negative physical and emotional effects like increased depression, obesity, alcohol intake, drug abuse, and insomnia. I have found support for my PICO question. Stress management and coping strategies do in fact help decrease burnout, though some strategies are superior than others. For instance, passive and avoidant practices like alcohol intake or drug abuse are ineffective for dealing with stress. Where all articles research regarded mindfulness-based practices as superior coping skills that aid in reducing overall nurse burnout. Okay, so burnout is the result of sustained work-related stress, which has been an ongoing issue within the healthcare profession for years. Christina Maslach and Susan Jackson originally developed the Maslach Burnout Inventory Scale, which assesses individuals' experienced burnout. So the scale measures 3 dimensions of burnout. 1, emotional exhaustion, which refers to a state of depletion with extreme energy loss and feelings of nothing left to give. 2, depersonalization, which refers to negative thoughts, attitudes, and behaviors regarding your job. And 3, lack of personal accomplishment. So an individual is lacking feelings, they're not concerned about when they fail to meet goals, and they don't really care about their personal competence. So the literature emphasizes that emotional exhaustion is the primary dimension that determines overall burnout, and almost all articles I researched incorporated the Maslach inventory scale for measuring burnout. So I wanted to share some interesting work-related factors regarding burnout. So repetitive exposure to traumatic events can increase burnout. Confrontations with severe injuries, death, suicide, and aggression also can increase burnout. So in the emergency department I work in, we have a resuscitation nurse who goes to the recess room, so a life or limb room. So we get cardiac arrests, traumas, you name it. There's no limit to the amount of times the individual can work in that role per set. So many times I've been there my entire set. I felt completely exhausted, and I feel this research is significant. I may actually bring it to my manager because research shows that manager support is needed to restrict staff exposure to these types of situations when trying to effectively deal with burnout. Organizational factors that can play a role in burnout, well, you can read them there. So availability of resources, nurse-physician collaboration, communication, decreased quality of schedules. So I think it's important to recognize there can be some individual factors that place us at increased risk for burnout. Are younger or older nurses at increased risk? Interestingly, my research found that younger nurses under 30 are at higher risk for developing burnout, as overall they scored higher levels in emotional exhaustion and depersonalization. Now we have to remember emotional exhaustion is the primary predictor of burnout. Older nurses experience higher levels of personal accomplishment, assisting with job satisfaction. Literature reviewed also shows women to be at an increased risk over men, though many sample sizes were predominantly women. Now, the Big Five model argues each individual has five basic facets to their personality: neuroticism, extroversion, agreeableness, conscientiousness, and openness. So the different dimensions of burnout are affected differently among these personality traits, though neuroticism was found to have a significant positive relationship with emotional exhaustion over any of the other personality traits. As I previously mentioned, mindfulness has been regarded as a superior coping strategy. So just to review, mindfulness refers to critical self-reflection where an individual becomes aware of thoughts and feelings and recognizes personal bias. When practicing mindfulness, we're not relating any previous feelings regarding similar situations to the one we're currently experiencing, as mindfulness is self-directed practice for relaxing the mind where you're conscious of the present moment, ridding the mind of any negative thoughts. Practicing can involve meditation, focusing on the inner self, breath work, and basic yoga. These practices can be performed as little as 10 minutes a day with positive effects. Now, physical activity has been shown to decrease stress, which is associated with lower levels of burnout. However, yoga specifically focuses on the mind-body connection and can reduce burnout, reducing both the emotional exhaustion and depersonalization dimensions of burnout. So, although the body of evidence is not yet fully developed, 3 systematic reviews and 2 randomized control trials have determined a positive correlation between mindfulness and decreased nurse burnout. So, based on these findings, I propose a 2-part intervention directed at the individual level to tackle nurse burnout. The first part focuses on education surrounding mindfulness-based practices, and the second part involves implementing learned knowledge and techniques in the clinical setting. The program is optional and based on Kabat-Zinn's theoretical content. The initial mindfulness-based stress reduction program developed by John Kabat-Zinn and colleagues incorporated 8 weekly group sessions which combine yoga, meditation, and discussions about the overall benefits of mindfulness in reducing stress. So key stakeholders necessary for successful implementation of the program are listed there. Part 1 and Part 2 of the intervention are both directed at the individual level, with the target population consisting of the nurses at Dartmouth General Hospital. In Part 1 of the intervention, educational sessions regarding mindfulness-based practices will be provided, discussing why such strategies are important, ways to practice them properly, and the overall benefits regarding nurse burnout. This part of the program aims to provide nurses with skills for dealing with stress, further enhancing participants' abilities to face challenging situations in both home and work. It consists of 8 weekly educational sessions, beginning with a 4-hour session of intense information, followed by 90-minute sessions practicing learned techniques. Peer champions will be further trained to act as mentors for staff on respective units. Professional quality of life surveys and journal entries will be used to determine initial burnout risk and post-intervention effects. Individuals will also be expected to practice strategies at home for a minimum of 10 minutes per day. Upon completion of the education sessions, participants will integrate learned mindfulness-based strategies into the clinical setting. Because each clinical setting is different with diverse demands and tasks, to realistically incorporate mindfulness in the working life, participants will practice such strategies whenever possible. An individual does not need to be separated from his or her environment to focus on the present moment, concentrate on breathing, or bring attention to the current situation. Participants will be expected to take note of opportunities to practice mindfulness-based practices when signing into the computer, waiting in line for Pyxis, prior to picking up the phone, or just before entering a patient's room. Mindfulness can be practiced for as little as 5 seconds and is a way to deal with situations that elicit negative emotions or feelings of stress, helping nurses to respond mindfully rather than mindlessly. Interestingly, it is important to note much literature reviewed emphasized need for the continued practice of interventions to sustain long-term positive effects related to decreased burnout. When creating my program, I opted to record initial sessions for continued review and to assist with the overall feasibility, though I now feel that refresher courses in addition to recording should be offered yearly, as facilitators will have to continually incorporate up-to-date education based on current evidence. Summary of my presentation is as follows. You can read the points there. Ultimately, it's important to note there is support for stress management and coping strategies in decreasing burnout, and research reviewed shows nurses who don't practice stress management have increased or no change in burnout levels. Obviously, some coping strategies are superior than others, as we've discussed. I just wanted to thank you guys for watching the presentation. I know I talk fast, it's part of where I'm from, but I think that this is a great group of classmates, and I know I've learned from each and every one of you. So thank you, and all the best.